What is it that you are working on, knowing that this is going to happen?
Well, good morning, Jane, to you and your viewers. We've published yesterday our views that we think that the surge, which is clearly now upon us, is likely to peak, as you said, towards the end of August, beginning of September, then plateau and carry on certainly well into the fourth quarter. So we expect increasing levels of both infection and, of course, mortality throughout the balance of the year, at the very time when our economy is still suffering from the effects of the pandemic. And so we've got really two important messages, we think, not only to the business community, but to society at large. The first is that we all need to take the necessary preventative action to prevent the curve of transmission to the extent we can, obviously by behavioral change. And the second is that we need to responsibly, but nevertheless, activate the economy in every sector to the extent possible, starting now, and embark upon some very fundamental structural reforms, which are going to be absolutely necessary if we're going to be able to get out of the, not recession, but depression in which we find ourselves for the balance of this year and probably much of next year.
Who initiates and implements those reforms? Because that's always been one of our problems.
Well, interestingly, the letter that was entered into between the South African government, the Governor of the Reserve Bank, Minister of Finance, and the IMF that was published yesterday makes it clear that we're fully committed to structural reform. That's in line with the commitments that were made by the Minister of Finance in the last quarter of last year. The President himself has endorsed them. And we as Business for South Africa, some 2 weeks ago, put out our own proposition in terms of the need to embark upon accelerated, inclusive change in terms of the approach to the economy, which is fundamentally aligned to that. And the only way we're going to do that is by taking those decisions, which are very difficult decisions, ruthlessly prioritizing our choices now, and then moving into implementation. And we need to recognize that no one of us, not government, nor business, nor indeed our social partners, labour and civil society, can do it on our own. We're going to
how
have
do
to
you
work
cement those partnerships? Because there's a lot of talk about unity, but we know it's easier said than done.
Well, I think that there are many areas where there's good examples of that. The work that we've been doing in NEDLAC currently around the pandemic itself, whilst we're dealing with the surge, has demonstrated, I think, real unity in action between social partners. The infrastructure program that was announced at the beginning of this week is predicated upon public-private cooperation, where the private sector is going to have to access the majority of the capital that is required. There are also many examples where we're not working as efficiently as we could. But I think Business for South Africa has mobilized very significant resources, including bringing PPE into the country, ensuring that we work hand in glove with the healthcare sector at a national and provincial level, whilst in the context of our economic intervention, dealing with all of the economic ministries, as well as I said, our social partners, to identify what are the key priorities, what sacrifices are going to have to be made by each and every one of us if we're going to be able to turn around the trajectory of the economy.
So important then your initiative, that return to work initiative, specifically knowing that this is probably going to be with us for the next 2 years.
Well, return to work, Jane, is absolutely predicated upon responsible behaviour. Social distancing, hand sanitisation, the cleaning of surfaces, wearing of face masks, in all environments, both at work, in the public transportation to and from home to work, and of course in public areas, as well as in our own communities, which is where the transmission is taking place. We need to stop our hospitals from getting overwhelmed. We need to ensure that those that are elderly or indeed have comorbidities work from home and stay at home, and provide them with the requisite support, particularly the most vulnerable in society.
Martin Kingston, thank you.